Good afternoon, everyone. Oh, is it noon again? Is it 12 o'clock? Do the days keep going? And then you just look up and say, is it 12 o'clock at night? Is it 12 o'clock in the day? I don't know where you're tuning in. I am Kevin Impeccable Peck, and this is the Chicken Box. That's right. Grab your lunch, your breakfast, or your dinner, depending on what part of the world you are listening in for. We have a show today. We're going to get right to the topic. It is Black people versus the COVID-19 vaccine. That's why I want to be specific, because there's other vaccines out there that are still floating around that you need. But this COVID-19 vaccine, Black people, what are we doing? Are we taking it? Are we not taking it? Are we in fear? Do we want somebody else to jump off the ledge first? We're going to find out. We have a special guest today, but before we do, my co-host, Dr. Draper, how are you?
Well, good afternoon, Kevin and Misha. Hi, I'm Frances Tony Draper, publisher of the 128-year-old Afro-American newspaper. And Kevin didn't say it, but we have an intergenerational discussion every Thursday at noon. And so I'm representing for the boomers, but as my millennial friend says, I am a millennial boomer. Or is it a boomer millennial? I don't know. Misha, I'm going to pass it to you.
Well, I have no idea if it's a boomer millennial or millennial boomer, but I'm right there with you in whatever the switch around is. And yeah, I am so happy to be with you all for another Thursday at noon. This is the day the Lord has made. Let us rejoice and be glad in it, because we got a lot to talk about today.
You know, it's so funny, because I'm going to let you guys in on the secret. It is impeccable to the world, but my boomer co-host, Dr. Draper, we're going to let you in just on a little secret. For those who don't know, that is my mother, so it's probably hard for her to call me impeccable. She calls me Kevin all the time, so, but it's your mom. What can you say? Anyway, this is the Chicken Box. Put a comment in the chat. We have a special guest today. It is Black people versus the COVID-19 vaccine. Whew, it's coming down. It's happening. We got people who said, presidents who said they ready to walk the plank. They're going to do it first on TV, live, on air. Man, but our guest today, Dr. Sherita, should we say Hill Golden? She's going to correct me, but she's going to give us some insight. She's from Johns Hopkins, and she's going to break it down, and she's going to really talk to us about how it relates to Black people. So everybody, give a warm welcome to Dr. Sherita Golden. How are you?
I'm good. Thanks for having me.
Good morning, and welcome to the Chicken Box, where we speak truth, we dispel stereotypes, and we get a chance to get on the Chicken Box and just whatever, vent, talk about it. I couldn't think about it because I wanted to get on the box and I got frozen. I was like, you pretty much say anything you want to say about about the topic or something that's just really bothering you that you just really need to get out there in the air. So let's get this thing going. Dr. Golden, why don't you just give a 30 seconds of what you've been doing over these last years and really before we get into the topic, so people get a chance to know you for a second.
Sure. So I have grew up in Maryland. So I actually was always like reading from the Afro, even from a little girl. So even though we were in the Washington, D.C. suburbs, my parents were very much, readers of the Afro, and they were like, you've got to try to get in the Afro newspaper one day. So, but I have been at, I went to college at University of Maryland, College Park, and then I went to medical school at University of Virginia, and then came to Johns Hopkins in 1994 to do my residency in internal medicine, and then subsequently did a fellowship in endocrinology, diabetes, and metabolism. So I have been a physician at Johns Hopkins for about 26 and a half years, and spent most of my career focused on the care of patients with diabetes. But I think one of the things that became apparent to me is that even though we had all of the evolving medical therapies that could treat diabetes and improve outcomes, that for many of the patients I cared for, there was really a struggle around making sure they actually had access to those treatments, that they could afford those treatments. A typical diabetes specialist will say, oh, go out and exercise and, eat healthy food, but that assumes you live in a neighborhood where you have access to those things and that it is actually safe to go outside. So it became clear to me that your environment informs your health behavior choices. And so the other thing that I always had a passion about was around diversity and inclusion in healthcare and medicine. So, it's not been uncommon for most of my career for me to be like the only one in the room, or one of two, to have those comments said, oh, you speak so well. And so I would always joke because, I grew up in Joe and Vivian's household and speaking bad English was just not an option. My mother will still correct my English to this day, and she's 85 years old. So, speaking well is not just limited to like one group of people. And so, I really want to move beyond being the first or the only. And so about 18 months ago, I took on a new role at Johns Hopkins Medicine as Vice President and Chief Diversity Officer for Johns Hopkins Medicine. So we really look at workforce diversity as really a matter of life and death, because really if we don't address our biased behaviors, then it's going to actually result in bad decisions and outcomes for our patients. So I think you can't achieve true health equity without that. And I think COVID has really shed light on everything around health equity right now. That's a challenge.
Absolutely. So welcome to the Chicken Box, Dr. Golden. We understand we have some other connections out there. So in any of the Deltas out there, give a shout out, put a little thing in the chat if you're tuning in. Listen, we forgot to share, you guys. If this is popped up on your feed, just hit the share button, because when we share information, we're a lot stronger. We're talking about Black people versus the vaccine. We have an expert on and a diversity expert on who's going to help us really get this show started. So we appreciate you share, because when we share, we're all stronger. 128 years, the Afro-American newspaper has been informing, educating, and inspiring us to move on and move to the next level. And the next level is coming, because the 2021 is right there. So look, we're talking about Black people and the vaccine. What are your thoughts? What pops up in your head, Dr. Draper? You're going to get 30 seconds. Let's start you on the box now. When you think about this vaccine, your initial thoughts.
So when I think about this COVID-19 vaccine, my initial thought, Dr. Golden, I'm probably the only one on this panel that remembers this. My initial thought is back to the polio vaccine. I was a little girl when that whole controversy came up about who's going to take the polio vaccine or not take the polio vaccine. And it was brand new, and there were, concerns about the side effects and all of that. And then it was a requirement. And now I don't even think you have to take the polio vaccine anymore. But when I think about this vaccine, here's what I'm telling people, and here's what I'm telling myself. I have a doctor that I trust, and he's been my doctor for 25 years. If he says that he believes that it's safe to take, I am going to take the COVID-19 vaccine. I'm off the box.
Boom. If the doctor that you trust, you understand what I'm saying? It has to be somebody you trust around you somewhere that at least is educating you medically, says, let's go, then you heard it. Let me bounce past before I get to you, Dr. Golden, to our millennial friend. What's happening in your world?
Wow. I have so much to say after, first of all, listening to my new Shiro, Dr. Golden. Gosh, you've done so much. He's so incredibly inspiring. Thank you for your work. I think it's so interesting because I have a lot of anxiety around the COVID-19 vaccine. And I think primarily because of my own experiences with the flu vaccine. For many years, I took the flu shot because that was something to do. And I was in school and wanted to protect myself, and my parents thought it was important. And I sort of slacked as I became an adult in taking the flu shot. And I think the one year that I've taken the flu shot as a true adult, making my own decisions, I got the flu. And so I've been a little anxious about it since then. That was about 3 or 4 years ago. And yeah, I'm just sort of, I just don't know what to do. Unlike Dr. Draper, and I love that Dr. Golden talked about, having access and it sort of being a privilege to having access to a practitioner that you can trust. Well, I've had the same primary care physician for about 5 to 10 years, but I don't know if I necessarily trust them at this juncture. And so, while they get things done for me that's necessary and prescribe things, I don't know if I trust them yet. So I'm really excited to talk to Dr. Golden because she's a Black woman, looks like me, and I think based off of her history is vested in the Black community. And so, yeah, I want to be informed before I go get the vaccine.
That's a 5-year relationship. If you just tuned in, this is the Chicken Box, and we are discussing Black people versus the vaccine. And, it sounded like a relationship. Misha, you were like, I really, it's been 5 years and we've been dating and I still don't trust him. I mean, should we go forward on this relationship with this doctor, or or should I trust that he says the vaccine is good, but yet he's not taking it? So I don't really understand. He's sending me a mixed signal here. Dr. Golden, what were your first thoughts when you heard that the vaccine was coming down the line?
Oh, there's a lot to unpack in that, your question as well as the comments. But so you have to realize that I'm coming from the perspective of looking at how in the last 9 months that coronavirus has disproportionately killed African Americans, and it has been heartbreaking. I think if you are an African American in the United States, you probably know someone who has been infected or died from COVID. And unfortunately, I know people who've experienced both, who experienced a death. Fortunately, some who've also experienced a recovery. But it is really astounding that, we make up about 12% of the US populations. But if you look at those, 250,000 COVID deaths that we've had across the US, we make up like 25% or so of the deaths. And so had Blacks and whites been dying at the same rates based on their proportion in the population, there would be like about 25,000 more African Americans who are still alive. So I think I'm coming from that lens, having watched so many of our community members die and also watching our healthcare system be overwhelmed. And so, from a vaccine standpoint, they started working on this, immediately. And I think that, vaccination is important. So I've been one that's gotten the vaccine. So I got the polio vaccine as a little girl, Dr. Draper, and then and my son has gotten it. I mean, I always get the flu shot since I've been a medical student. 1 year I did get the flu because, it wasn't quite the 3-week window that you need to have the immunity. And I can tell you, I was so sick with the flu that I was like, I'm taking that flu shot every year because I don't want to ever feel like that again. So that, for me, that's sort of the perspective I come from with that. But, I think that the concerns around the coronavirus vaccine that I at least want to educate the community about, I think that, what both of our co-hosts have really said is really true, that you need to trust the physician that that you've been seeing. That's one important messenger in this. But I think it's also that there are other really important public health messengers that are trusted members of the community that are also key to communicating public health messages. So like, for example, like our pastors, our faith leaders, our pastor had my husband, I talked to our congregation on our Bible study last night, for example, because they value what, he says and thinks about this. Our civic leaders, all of those individuals are important to be messengers about this. So the messages need to come from outside the doctor's office. But I think the things that I think we have to acknowledge, and I've said this inside of my organization, that there are reasons that African Americans are going to have pause about a vaccine. And so we have to acknowledge our history. And, our past history is that in slavery, that there was experimentation that was done on slaves without their consent. And in fact, that experimentation continued even after the Civil War. And so, and not only just African Americans, but other marginalized groups, institutionalized groups, prisoners. And so a lot of that was still going on, you know, and in some of our lifetimes. Now there is a Federal Office of Human Protection for research subjects that really protects the population from that. So any kind of research study, you know, you have to give informed consent. Even if you've given consent halfway through, if you're like, you know what, I don't want to do this anymore, I'm not feeling it, you can stop. So there are protections in place. When you go into the hospital setting, either to get admitted or, you know, to have an outpatient appointment, you know, you sign a consent form to be treated. And then if you're in the hospital and you need a procedure, you sign a consent form before that procedure. So you have the decision to, you know, you have the option and the right to either decide you do or don't want to do it, or to get a second opinion. Right. So I think it's important to know that there are those protections in place now. And then there are those of us on the inside who are making sure that those things, you know, all get implemented the way they should, but they're protections. But I think we have to acknowledge that a lot of African Americans still remember the Tuskegee syphilis experiment, and that didn't end until 1972. I was 4 years old. We're talking about something that ended in my lifetime. I'm a Gen Xer. You can probably figure that out from the math.
Okay, well, I got somebody. Now we can gang up. Okay, all right. I just wanted to just check just to make see where we are in our mind, get our mindset together. So no, that's a good place to stop. If you just tuned in, this is the Chicken Box. And I'd like to shout out, we have Mina tuning in, Curtis, Eric, Christopher Jones. We got Alicia, Kim hanging out with us, Adrian, Byron Deese, Rachel from Atlanta, one of your sorors as well, Dr. Dorothy Bower from PA, Wendy from Maryland. Just put a one in the chat if you're enjoying this conversation about the Black people versus the COVID-19 vaccine. What we gonna do, people? We've had all kind of other vaccines, and because we didn't live through, and then it was interesting to hear Dr. Draper share about, was it smallpox?
Polio.
I took you all the way back there, huh? Smallpox. Polio. Anyway, you know what I mean? It was always something that came before this. You know, it's just that we're living through it now. And we don't want to live with it, you know what I mean? So, but we still have to figure out a way that makes sense to really begin to really control this situation. And, you know, if the vaccine is working right, then we're going to be able to control it. But we got to get past the fear. So Misha Green, what are some of the stereotypes that you're hearing out there right now about the vaccine? Put us down with what's happening on the street.
Alrighty, so again, as I always say, these are solely stereotypes, not necessarily facts of the Afro or opinions endorsed by the Afro. And again, guys, please weigh in on the comments. These are by no means the exhaustive end-all be-all stereotypes. Look, I'm on social media. The memes about the COVID vaccine run long and deep. So these are only a couple that I'm sharing with you today. But one is that Black people won't take the vaccine because they don't trust it in medical professionals. The vaccine will not necessarily prevent from COVID-19, some people think. Some people think Black people can get sicker from the vaccine, particularly thinking of sort of the history behind what the Tuskegee study and things like that. Moving into that, Black people will be used as lab rats to test the vaccine, considering Tuskegee. Of course, we know that they weren't actually treating those in Tuskegee accordingly. But again, just with the lack of research, that's lack of research in history and understanding pieces of the history and understanding. That's one that I'm seeing a lot of. Black people will not have access to the vaccine is one I'm seeing a lot of. And that older African Americans are the only ones considering taking the vaccine due to COVID risks.
Stereotypes, guys, if you've heard them and you're tuning in, put it in the chat what you've heard out there on the street, or what you think you heard and you made up. But just put it out there. It's all a stereotype. Dr. Golden, have you heard any stereotypes in your walk?
Well, I have heard Many of the same ones that Misha just mentioned. They're running rampant. And so I'd like to dispel a couple of the stereotypes, if we could. And so, one is that, Black people will not be used as lab rats. And so actually in the studies, of course, because I'm a scientist and I'm Black and I want to know how to educate my people, I've sort of gone and looked at all of the 2 clinical trials of the vaccines currently, at the FDA. So about 10% of the people in each of those studies were African American. They all signed a consent form, and agreed to participate. So no experimentation from that standpoint. So it's about 4,000 people in the Pfizer trial and about 3,000 in the Moderna trial. So I think it's important to know that some of us have volunteered to be a part of those studies. But from the standpoint of, you're going to get sicker from the vaccine. So like any vaccine, there are side effects. So like the flu shot, when you get it, your arm is sore for, a couple of days. Sometimes you feel like achy and fatigued. That happens with the coronavirus vaccine also. Like you may feel achy, fatigued, spike of fever. That usually all resolves within about 48 hours because that's your body like developing the immune response to it. It is 2 shots. So, it's not 1 shot like the flu is, so it's not so much that you're getting sick, but it's that, your body is developing its immune response. And so that's what you're feeling. So I think that's important to know. I think we have to realize as Black people, we also get sick from the coronavirus and we're dying. So like we got to weigh the risks and benefits here. I remember a patient told me one time, she said, you know what, Dr. Golden, I'm sick of you prescribing all those drugs for me to lower my cholesterol. I don't want to take a statin. So what I want to do is take these herbs. And she literally plopped a big bag of 40 bottles like up on the exam table. And they were all like these herbal supplements bought over the counter. And I said, well, I don't know what's in those herbs because the FDA doesn't regulate those. And, and actually the last time I looked, heart disease killed people. And so that was sort of how we had to walk through that. So same thing with coronavirus, like, we're getting it and dying. The beauty of the the FDA process is that they've been very transparent about that from the beginning. And that, they basically, they have the authority, they look at the data and make sure that the data are sound. I will address one question that just came up in the comments. And one of the other concerns that everyone has had, and I'll be honest, I had this concern and did research to understand, is that this all happens so quickly, right? And so it takes like years typically to develop an effective vaccine. And then there was an operation put together called Operation Warp Speed. And the word warp speed, makes you maybe feel like, ugh, what does that mean? So speed, I think some people are equating with cutting corners. And so I just want to sort of explain what like Operation Warp Speed and what that is and why it was done that way. So because this was a public health emergency and everything is happening so fast and people started dying so quickly, there was an investment, basically a partnership between, public health, the Department of Defense, Health and Human Services, and the private sector to basically make sure that, we could bring vaccine development to fruition more quickly. So a trial the size of these 2 trials, enrolling 30 to 40,000 people, really take years. But if you invest the resources, you can recruit more quickly, right? And so that's how they were able to recruit for the study so quickly, because it was a financial investment. And then the scientific process has been sound throughout. But then once they realized, it looks like this vaccine is effective. Normally what would happen is the vaccine is effective. You go to the FDA and go through their review process, and then you wouldn't start manufacturing the vaccine until after you had been through all of that process. But we've got people dying. Like we've got millions of Americans who've been infected. So therefore, as soon as they saw that this looks like it's an effective vaccine, then the companies had the money in place to be able to start manufacturing. So it's that the processes that are normal done in tandem were done in parallel. So that's why the process went so fast. But I can understand why that gives people pause. And so I spent most of the last 2 weeks and most of my Thanksgiving reading everything I could about Operation Warp Speed and the vaccine development and everything to educate myself about that piece.
Well, thank you for chiming in on that question. This is the Chicken Box. You're on with Dr. Sherita Golden, Misha Green, our DC editor, and Dr. Francis Draper, the publisher of the Afro-American News. And we are tackling the question that is on everybody's mind, at least for African Americans, and probably for everybody else as well. What's happening with this vaccine? You know, warp speed or not, there is some mistrust out there in general, and you can I really got a better understanding, Dr. Golden, when you just talked about warp speed, because you have a full concentration and you have the full dollars behind it. You can't accelerate it. Some people will call warp speed cleaning their house. They don't ever clean it, but you know what I mean. But if they just concentrated on it just for a couple hours, they could knock it out. But it's anyway. I'm just saying, I can understand if you focus on one thing solely. And with the technology today and the way information can be passed, that we can get to a place where we can get a result. And we have African Americans working on that as well, on the vaccine. And you got a lot of them in the company who are looking out and really giving us the information. We're not just lining up to take the truth serum anymore. So there's been mistrust. Dr. Draper, why don't you come on and tell me about the mistrust that you have heard, or how far did this mistrust go back?
Well, it goes back a long way. But let me say, first of all, wow, Dr. Golden, what a treasure trove of information you have. And I was just sitting there and thinking that you, as a physician, you've been at Hopkins a long time, trained in so many things. And, you've spent a couple of weeks reading what most of us won't understand, even if we did read it. So that's why we do have to trust those who know what they're reading. I used to be the community member on an IRB, Institutional Review Board, for the review of clinical trials. And that would take me forever to try to understand that as a layperson, with the medical colleagues. And so the other thing that you said, I'm going to talk about this history, but really it's key. If we could do warp speed for COVID, and it's just a matter of resources, why can't we do warp speed on these diseases that are killing African Americans disproportionately, and really put a stop there? And I think when we look at the structures, we've been throwing around the terms for a long time, systemic and structural racism. There's so much systemic and structural racism, talking about the history in the medical field, that it just seems like if we have the means to do it, which we do, we need to have the political will to get it done, and not have another Tuskegee experiment. We've already brought that up, but historically, back in 1932, when there was no known treatment for syphilis, and so, these participants were sharecroppers who had never visited a doctor before, and so most of us are familiar with that history, but that really built a lot of mistrust, and people still refer to that, or they refer to what happened with Henrietta Lacks, and the healer, her cells. So you do an experiment on somebody, you never tell them, you don't know what happens to it. And so Hopkins has done some things to try to ameliorate that whole situation. So the mistrust is deep. And I think, Dr. Golden, I'd be interested in your take on this. With the level of comorbidities that we have as African Americans, and the disproportionate amount of us that are getting sick and dying, even with this vaccine, will there be, do you think, not because of the vaccine, but just because of already the things that we're dealing with, that this will compound? And so that if some of us, especially those of us who are older, who may die of something that would have happened anyway, but then we take this vaccine in a large number, people are going to start to, speaking of stereotypes in history, we're going to start matching that up and say, and I think there's some kind of trepidation that has to be in the medical field about that too.
Yeah. So do you want me to comment now?
I'd like for you to comment now.
Yeah.
This is
where
I'm going to get on my chicken box.
Okay, she's ready to get on the box. As I kept thinking about chicken box, I thought about chicken pox. And I remember we had to get a vaccination for the chicken pox. I'm like, wait a minute. This is just sounding too familiar here. All right, Dr. Golden.
Get on the box. And a lot of our viewers have questions too, Kevin. So go on, Dr. Golden, get on the box.
Yeah. Okay. So there's so much in what you just said that is so crucial, to understand. So, one of the things early on in the pandemic, when it became clear it was disproportionately killing Black people, I had a reporter, ask me, so is Johns Hopkins doing any research to understand why there are these disparities in COVID and why there are all of the excess comorbidities? And, I said, well, no, because we already know why this happens. We don't need any research. And I think that we have to acknowledge, two important factors. And this has really become like almost like I will talk to anyone who will listen in the Maryland legislature about this at this point, is that the reason that we were so susceptible to COVID is because we have been exposed to these biased experiences in the healthcare system. So, there was this experimentation where we have mistrust, but then there was also this history of the eugenics theory, which is scientific theory that somehow Blacks and other non-white groups are biologically inferior. So we know that there is absolutely no justification or scientific validation of that today, but yet there are many physicians and healthcare providers who think that, Black patients are less intelligent, or we're less likely to adhere to therapy. And so all of these things contribute to a poor quality of care experience in the healthcare system. So you can understand people either won't go, or if they go and get poor quality of care, they're more at risk for diabetes, heart disease, and all those kind of things. And then the other thing is that, there are all of the historical practices like redlining, which we unfortunately, developed here in Baltimore and spread throughout other parts of the country, but redlining, which resulted in a lack of economic investment in neighborhoods. So now we have neighborhoods where the school systems are poor, there's no access to healthy food, there's no place to exercise safely. So no wonder you're at higher risk for diabetes, And so those things were in place. So we already had a higher risk of, diabetes, heart disease, hypertension, obesity, all the things that are making us at risk for dying from COVID. And then we were exposed more because we were working in jobs that were considered essential during the pandemic. At the beginning, there was not enough PPE. And so all of these things have put us at risk for a poor outcome. So what I think we need to do to really address COVID and all the chronic diseases really is to, sorry, I'm on my chicken box and somebody is trying to call me. I just silenced that.
Hey, we all the way live here at the Afro, so don't worry about it. It happens. Your phone, my phone rings. I just happen to be on mute. I even answered it, so go ahead.
Right. But I think that we need to really address those things that are considered social determinants of health. We need legislation not only to make sure we have access to the COVID vaccine. So, one of our goals from a health equity perspective is to make sure that everybody who wants to get it and has educated themselves and feels comfortable has access. But then you've also got to address like economic disenfranchisement, housing stability, access to healthy food. All of those things are important. That's where the structural and systemic racism is manifesting itself. And so I've talked to all of our minority caucuses in the State House, the COVID Legislative Working Group, all of those groups. And I can tell you that there will be some legislation to address health disparities and these root causes in the January session.
We can't wait.
That is like, I will tell anybody who will listen, any legislature, like, can I call you on the phone? Let me tell you what is really needed. So yes, the vaccine is important. We need to make sure there's access for people who want to get the vaccine. That's really important. But it's like, what are the root causes here? Many people are like, oh my God, I can't believe, how much, racism there is and how this has impacted people. Those of us who are African American have known this for years. This is just the first time that people really hear us. So since we have their voice, then we've got to really make sure that we get all of the legislators, the leaders on the healthcare system side. We're doing that inside of Johns Hopkins Medicine. We have a town hall this afternoon that's a part of our anti-racism and structural racism town hall series, because we want our Black, brown, and white colleagues to all understand the manifestations and how we really need to address this. Like, we need policy change in addition to what we do inside the health system. And we need partnership with you all. We need partnership with our community.
You are partnering with the Afro right now. Johns Hopkins, you are looked upon as a leader in the medical field, not only in Baltimore, but around the world. And I always have led the charge. And we're looking forward to you guys giving us the real. Let's just keep it 100. We don't, and we're glad that we have somebody inside who can really keep the balance, who can check the checker when it needs to get checked. But we got some good questions. We have a question from Jewel, and I don't know if this is a stereotype or is this the truth, The vaccine will not stop you from getting disease again, will it? Or
Yeah, so I mean, yeah, that's a good point. There's a lot, so we'll be transparent, and I can tell you, and this is the sort of approach that Johns Hopkins Medicine is taking as an organization. We are giving people the information we currently know, and so we don't know the long-term effects yet. We have every reason to believe that it should keep people from getting coronavirus. What we don't know is it going to be like the flu shot, where each year you need to get a coronavirus vaccine because it mutates a bit? And I think that's information we'll find out over the next year. But we know that in the 2 trials, it was over 90% effective in preventing people from getting coronavirus. So it does prevent you from getting it. The question is, how long does that immunity last? That's what we'll be able to find out from following the people that were in these trials that are currently ongoing.
how long do you need typically to know, or like what time span do you know if in fact a person could possibly get it? Like how long does the vaccine last? Is it a 5 year? Is it a 1 year? Is it?
Yeah, that's the information we don't know yet. So the people that were in those trials that that are now with the vaccines that are at the FDA right now. In fact, one of them will be either approved or not today. But those people were enrolled like back in June, July. So like now they've been almost followed for 6 months. So then, they're going to continue to follow them to see how long that it lasts. And so, the issue is that, is it going to mutate a little bit? And if it mutates a little bit, then, then that may mean that, okay, each year we're going to need a coronavirus vaccine. So, and I want to point out one thing about this COVID vaccine. The other thing here's a stereotype I've heard is that, well, this is a novel technology. How do we know it works? And it was put together quickly. So the novel technology, this mRNA technology, has been developed over about 10 years. So the technology is not new. This is just the first time that we're applying it to a public health emergency. And the scientist at the NIH who has led the charge in this new technology is Dr. Kizzmekia Colbert. She is an African-American scientist. She is running the coronavirus vaccine work team at the NIH. And so Dr. Fauci wants everybody to know she's a Black woman.
So is Dr. Fauci our guy?
I'll be honest with you. I follow the things that Dr. Fauci says, and that's not an endorsement. But honestly, I will tell you all this story. When I was in college at the University of Maryland, there was a program at the National Institute of Allergies and Infectious Diseases. And so that's the institute that Dr. Fauci runs. And they had this program to interest underrepresented minorities and women in science and medicine. And so I did research in that institute for 2 years at the NIH. So he was committed back then to making sure that young people like me would have access to careers in like science and medicine. And he is just so highly respected. So I think that he knows his stuff, and he's giving us the right guidance. And I think had his guidance been heeded, like universally, that we'd be in a much different place.
Absolutely. Everybody who's tuning in, this is the Chicken Box. I'm thanking you for your comments because we can't have you all on air, but we do have your comments right in front of us. And some of the questions we want to get to, we have a couple people who say they think they experienced the symptoms back in November last year before it was really put out there that what was really in front of us. And they went through it. Some say they trust their doctors. They don't trust their doctors. We have Alicia saying, and will this vaccine be free to the public, or is there a cost if you don't have medical insurance?
Yeah, so the vaccine will be free. What is still, I'm waiting to hear clarity about, I think many of us are waiting to hear clarity about, like if you go to your doctor's office to get it, and just to put it in perspective, the supply will be limited initially, so probably will be available to the general public in the spring. So I think that's important in giving people time to really think through their decisions and for us to get more information. So like if you go to your doctor's office and you get the vaccine, is there going to be an overhead charge there? Like I think those are the kind of barriers that we're going to want to make sure that we remove. But the vaccine itself will be free.
Yeah, so I'm hearing it's more than one company, right?
So there's Pfizer and Moderna are the two that right now have today they will make a decision about an emergency use authorization for Pfizer, and then Moderna is on the 17th as their review.
Now, could you get a shot from Moderna and then get a shot from Pfizer?
No, you can't mix them up.
You can't mix them, people. This is not your favorite drink, so do not mix.
Yeah, once you start, you want to finish with the brand that you have. So,
Dr. Golden, sorry. First of all, I am cracking up. Impeccable is on one. Kevin Hart, watch out. But my question goes back to something that I've heard a lot of people say, and I was actually brainstorming the other day and wondered, am I guilty of possibly having said it myself, which is that it's possible that they had COVID-19 symptoms far before we knew it was even here in the United States. I hear it all the time. And I think the joke used to be is all the Black people said they been had COVID. I was like,
right.
I had COVID in January. But I've heard so much and almost wondered, myself, in December of 2019, I had a really bad cough that just was chalked up to bronchitis. And so I've wondered, is it possible that people had it and did not know?
Now, scientists are thinking that coronavirus may have been in the US as early as this time last year. And if you think about it, it was really March when we first started hearing of the first cases here. I had a nasty cold at the end of February, and sort of like you, like achy. I didn't have a fever, but I mean, just coughing and coughing and coughing. And now I'm like, like my husband and I are thinking back about that whole like cold I had, and now we're wondering because the range of experience with coronavirus is the range of you got a mild cold, or you're asymptomatic, or you got a mild cold, or you are in an intensive care unit. So there's a range. And so, but there is a suggestion now that it was probably in the US, like sort of this time last year, even before, those official first cases came to be.
It came in without a passport as well.
It came in without a passport.
And a lot, and there's a lot of people out there. This is a chicken box if you just tuned in, who are getting sick like normally they get sick, but because of the coronavirus in the air, their mind takes them straight to I probably have it. I have some family members who they swore. I mean, you could have told them like the wall is white, and they keep saying no, it's purple because I feel like it's purple, but no, it's white. But I'm thinking it's purple, but they haven't gone to get tested. And so if your mind is so anxious, and we know the tests are different and you can take more than one, please go get tested. Don't attract in your mind the coronavirus if it's not there. You know what I mean? Because it's a lot of other things that happen. That's why people take the flu shots. As you got 50% of people take the flu shot. I think it's that number, and 50 that don't. I never have. And my flu shot has been, I always say I don't get sick. And so I've lived off that for 53 years. Well, actually, I used to say I only get sick maybe once a year. And I would only get sick like once a year. I would say, wait a minute, I got to stop saying that. I got to just say that I don't get sick, period. And that's my story. So I feel a way about the vaccine. But Dr. Draper, you've been quiet too long. So let me just let you in this conversation, right, about what you're feeling as we close out this hour on Black people versus the vaccine.
So there are so many unanswered questions. Again, thank you, Dr. Golden, about this vaccine. We're going to ask you for your medical opinion about whether we should or should not take it. And I know it's probably an individual decision, but I'm just wondering, suppose some people do take it and then some people don't take it, right? Can you talk a little bit about, is there a concentration of people that need to take it in order for it to be, effective for the general population? And we didn't even get into that whole herd immunity thing, which I think is crazy, but you probably think so too. But speaking of stereotypes and thinking of misinformation, I think about the doctor that just got his license suspended because neither he nor his clinical staff would wear their mask. I mean, there's just so much misinformation that some of it that comes right out of 1600 Pennsylvania Avenue. Thank God that's changing. But can you say something about that? How many people actually need to have this vaccine? So if Kevin doesn't take it, but Misha does, and I don't take it, but you do, I mean,
Yeah,
what do you
so
think?
you generally, in order for there to be immunity, and this is either immunity from the vaccine or, people who've been infected and recovered, it's about 70% of the population. So it's a significant proportion of the population. So what's important to recognize with that is that that means that we're still going to be doing masks and social distancing and hand sanitizing for an extended period of time. For people who decide to get the vaccine, they don't get their shot and then throw caution to the wind and throw everything out. So I'm like, we're going to still be needing masks for a significant period of time. So, I've been telling everybody is that Christmas is coming up, get all the masks to match all your different articles of clothing. So that because I think we're still going to need that public health practice. That's going to be particularly important.
Absolutely. This is the chicken box. We're winding down. Let's throw in the Afro facts right here. Let's everybody woosah about the vaccine to decide what you're gonna do. I have my 5G stereotype. I have my thing about the vaccine that I'm gonna throw out there. It's conspiracy theories going on with this whole virus and all kind of other things going on. But Misha, let's go to Afro facts right now. Let's just switch the topic for just a minute, and then while we think about this vaccine and how it is affecting our community, and how do we get back to somewhat normal that'll be the new normal, because the old normal is now not normal.
Yes, no, I'm happy we're switching gears, because I can't lie, I've had a tickle in my throat for the past 20 minutes because we've been talking about it. Like, where's my water? So I again, I want to say thank you to all those who are tuning in, and really special thanks to Dr. Golden. Guys, sharing is caring. Make sure you share this stream. This information is so important. And even if you're not watching it right now, you can save it and watch it later. All right, and this week's Afro fact is inspired directly from the Afro archives of our December 12th, 1972 paper. Ironically, this week's paper is also December 12th edition, but in 1972, our headline was about a reporter named Paul Gutwein, I hope I'm saying his last name correctly, who was suing his employer, the Eastern Star Democrat, after he was allegedly fired for being engaged to a Black woman. When he told his boss about the eviction, he said that he first told him everything would be okay. But then he turned around and was being fired because the residents of Talbot County might have been disgusted by his interracial marriage. Time passed since he was fired, and then this court case in 1972 happened. And Gutwein was remarried to what appeared to be a white woman, and they both were teachers in Silver Spring, Maryland. However, the newspaper he worked for previously testified he was dismissed because he was disheveled and had a lot of mistakes in his work. While Gutwein admitted he was a rookie reporter with mistakes, he said his boss knew that going in and insisted he was fired because of his then Black fiance. And that was the headline from 1972, and that's this week's Afro Fact.
There you have it.
Boom. We're gonna have to do Black people versus interracial marriage. Okay, that sounds like a topic that everybody would like to chime in. And as we go back, love is love, is it? Can you really blend the cultures and get along and take? And there's been people who've done it, and there's people who thought about it, and there's people who say I will never do it. So anyway, let's stay on the vaccine. I wanted to just get to a lighter moment just for a second. Man, we couldn't unpack everything today if we wanted to, but we wanted to at least get some of these questions and thoughts that are going through all of our minds as this now becomes the mainstream storyline. Okay, we're so glad that 40 whatever number he is, he doesn't even get a number anymore. That's fading away in January. We don't have to hear no more main news about this other thing. Other human being. And we can concentrate on what's really important, and that's locking down. States are locking down again. Things are really trying to come to a halt because some states that were so loose like Georgia, we're just getting buck wild. You know what I mean? They're like, oh, the virus is a hoax. I'm not wearing the mask, and and then you're in certain places like stores, and I don't even know how some of these grocery stores let these people in. But it's nobody at the door. It's not like the mask police that's at all of these stores. So we need the mask police. That's a new division coming up. But listen, we're gonna get our final thoughts on this, and I'd like to thank Rachel, Craig, Adrian, Mina is still hanging out. Teresa, we have Eric, Avery, everybody listen, your comments fuel us. We can't answer all the questions, but we see the questions, and hopefully it sparks maybe at our editorial or further research that we can put in our legacy edition, which is our newspaper, or on afro.com, which this is a perfect time to give a holiday gift of information. Listen, if you want the real information that's happening in the Black community, you cannot trust other media to tell our story the way we tell it. But it takes money. I'm going to just put it out there, y'all. It takes money. And the other organizations, the institutions, they think about things that are important to them. And a lot of times it's not the African-American media. And the only way we continue to move for the next 128 years is if you would give the gift of a membership or a subscription this season. Get one for yourself. It's less than 2 Uber Eats. We're giving Uber money. We're giving everybody money. But let's give some money to our Black organizations and institutions who continue to keep the information in the forefront. That's not a PSA. That is a fact. Without y'all, we are nothing, okay? Without us coming together as a community, go to afro.com right now and get your subscription and give one as a gift. I even think it's a discount right now. Why? Because Uber Eats doesn't ever give me a discount. But anyway, that's just because we're in the giving spirit. So we're going to go final words on the chicken box. Dr. Golden, we're going to save you probably for last. So Dr. Draper.
Wow, Kevin, you just said so much. Listen, I just read something this morning.
She's never going to call me impeccable, everybody.
Okay. Like, mothers tend to call children the names they give them. And then when they really are on it, they call them their whole name. So
right, please don't. You're in trouble when your mother calls you your whole name, okay?
Right, you're in trouble. But I read something just this morning from the Poynter Institute, back on what Kevin was saying. 1,800, that's 1,800 newsrooms have closed since the beginning of COVID. 1,800. And so please, we need, sometimes we, the Bible says we have not because we ask not. We are asking. And if you want to read more on Dr. Corbett, for example, go to afro.com. And in terms of the COVID vaccine, there's so many nuances to this, Dr. Golden. We could talk for another whole hour. For example, can employers require employees to get the vaccine, like they do with school children? Or as an employer, do I have to take the risk that if you don't want to take it, you don't have a medical reason or a religious reason, what are the nuances in that? I mean, that's just more questions. And so we don't know the answers to those things yet. But what we do know, and Dr. Golden has said it, she'll probably say it again, we do know 250,000 Americans have died from coronavirus. We do know that there's a greater percentage of African Americans, brown and Black people, who have died in disproportion to the number of us that are in society. We do know that when we get sick, we get sicker. When we get a COVID virus, we're the ones that are in the ICU more often than other people. We do know that we don't have the same level of care as a Donald Trump, who can have 15 physicians at his beck and call and get every known treatment. So we do know how devastating and dangerous this is. Those are the things we do know. So whether or not people take the vaccine or not will probably be an individual choice. But in the meantime, and we do know that people are not wearing their masks as we're being asked to do that consistently across the country. And so we are in a healthcare crisis, and a crisis dictates an emergency response. And so don't know what people are going to do individually. I have not decided myself. I said I would trust my physician, but he's not decided yet. He's doing what Dr. Golden is doing. He's reading everything that he can and putting his scientific mind to work so that he can make an intelligent recommendation to those of us who are his patients. And he has said he's not yet made up his mind, Dr. Golden. So, that I'm off the box.
Sound like you really wanted to stay up there.
I did. Well, I did.
You could bring an easy chair up onto the box.
Right,
You know what I
right.
mean?
Well, it breaks my heart. I'm also a pastor, and so there are so many people, listen, who are dead or dying of this virus, and they don't have a person to call. They don't have a Dr. Golden to call. The plan they have is jacked up, or they don't have a plan, or they're by themselves, or they have so much misinformation, and so and and you can't even go to not that you want to go to a lot of funerals, but you can't grieve with them in a way that brings some kind of closure. And so they say quarantine, and so I had a member to say, well, Pastor, how do I quarantine? We've got 3 bedrooms and 8 people. Quarantine where? In the bathroom, in the kitchen. So just the whole disparity. So it's tragic, but we will get through this.
Absolutely. My millennial friend, you want to go next, or you want me to go?
You can go ahead. It's hard to go after a pastor.
Okay. Well, I'm going to go. I'm getting on the box. Y'all tune in because I feel a certain way about this whole thing. And it's a lot of, I talk to some of my friends and they go into conspiracy theories and they go into other things. And I'm just going to throw that out there. They were talking about how 5G was going to really harm people. Now, I don't know, doctor, and I could be totally left field with this whole 5G thing. Sometimes I thought this whole COVID is either an experiment on mankind or a distraction. Like everything is already in the back. Here's the virus that we're going to put out somewhere, and let's see how this affects the economy and does X, Y, Z. And we already have the vaccine, but we're going to pretend, wink, wink, that we're warp speeding it and we're working on it. But really, we already know how to handle this thing. It hadn't been a war in a while. Maybe we need to get some of the population down. Those are just thoughts that float out there in my mind, in the air. It's just a total distraction because right in the middle of COVID, all of a sudden I see all these 5G commercials pop up. I'm like, wait a minute. You know what I mean? First, the big talk was about 5G, but then you're hearing the bad things about 5G because we weren't meant to be in buildings when cellular was initially formed. It was more for outside, but now everybody's in the building and they got rid of their house phone. So that's a whole nother thing. So that just popped up in my mind. So that's my chicken box. As far as the vaccine is concerned, I didn't do research on the chickenpox vaccine and all other vaccines that they gave once we went to the doctor. You just had to have them. And I'm sure in a minute, the government's going to say you can't get a passport, you can't travel out the country. Other countries are going to say you can't come in without a vaccine. So are you going to be able to avoid it? I'm not sure. You know what I mean? I'm not sure. Eventually, are you going to be able to deduct the vaccine? You know what I mean? If they really want to eradicate it. So that's me on the box. And Misha, I'm bounce passing it to you. I'm off.
I have caught the ball. And I think the only thing that I'm going to add to the vaccine conversation, well, first of all, again, I cannot thank Dr. Golden enough for her insight. This has been such an incredibly informative and exciting conversation. So thank you so much. What I'll say about the vaccine is that as the vaccine becomes more and more available to us, just like everything else, let's continue to do our research. Let's continue to stay informed. I really appreciate the fact that COVID, a lot of the information about COVID-19 and the CDC in particular has been very transparent. And so the fact that we have the ability to do our own research is really great. But also, this is why you have us, the press, and the Black press, the Black Media Authority, here for you. This conversation and seeing you all's comments, and this is why we say please engage with us, has helped me as an editor know where we need to focus as we wrap up this new year and go into 2021. I see you guys' concerns, and I really appreciate that you guys have been active in the conversation. Continue to do so. Let us know what you need, what the issues are, and we as the Black press will try to not only research it, but give you some answers.
Boom. Dr. Golden, our esteemed guest from Johns Hopkins, also our diversity champion over there, making sure you keep folks straight and that they don't go too left, because they will, or there will be no need for a diversity officer in any of these companies because they wouldn't think about us.
Right.
You know what I mean? They wouldn't think about us at all. That's why we had to start the Black Press, because they didn't think about us. They didn't think we were doctors. They didn't think we had families. They didn't think we had weddings. They didn't care. You know what I mean? So we have to care and stop worrying about what they care about. We care about ourselves. We care about mankind, and we care about human beings, but we definitely care about the Black community. That's who we are. Dr. Golden, you are on the box.
Yeah. So what I would say is that, I think we have to really make sure, and this is why I can appreciate the media. My son is a journalism and African American studies major, about to graduate from Northwestern. And, and I will say something. He's like, Mom, did you check your facts? And so what I'm here to do is so that we can really state what the facts are and what the facts are not, because I think we need to be educated so we can make conscious decisions. Everything is under an emergency use authorization now. So there will not be any forcing of anybody to do anything. This is really going to be your decision. And I will say that, at least for me, and my part in this is that, you go through life and you sort of wonder what your purpose is. And, I sort of felt this call when this role opened up at my institution. And I thought, so I was like, Dr. Draper will appreciate this as a pastor. I was like, Lord, okay, I am really confused because I've spent my whole life to be a diabetes specialist, and I've been doing that really well. And you're telling me to stop doing that and shift my career completely. So I listened. And then so here, I find myself, and, the first year that I'm in this role, there's a pandemic disproportionately killing Black, Brown, and Indigenous people. There is the George Floyd murder that precipitates what I call the second civil rights movement. And now I realize there's this whole vaccine messaging. And so now I feel like this is like an Esther moment that, I'm here for such a time as this. And if I'm not here to communicate the appropriate messages, then someone else will. So, that's sort of what I feel my role is. It's important to partner with the community. And also there's not just me on the inside of Johns Hopkins Medicine and these other places. There are a lot of us on the inside, and we have a lot of allies. And so, I will make sure that our community gets the information they need, has access to the vaccine if they choose to. That's sort of what I see my purpose is. And that's sort of what our army of Black physicians feel our purpose is right now.
Boom. We got Esther hanging out on the chicken box with us, y'all. See, you heard what she said. She was going down one way, right? Just like Jonah. And he said, turn around. Let's turn around, for all you Bible scholars out there. And said, but she said, yes, Jonah was hard-headed. He had to go line up in the belly of the whale for a second to figure out, okay, I'm going to go this time, Lord. If I get out this belly, please. Look, as you approach 2021, you guys, man, listen, let God direct you. Let him be the most valuable player on your team. Let him give you the wisdom to really make key decisions for you and your family. And like your son said, I forgot his name, fact check everything. It was something put on the thread. I don't know who did it, but they said that they were padding the numbers just to keep the fear up in the Black community. And I had that question too, Dr. Golden. Have you heard of any audit that we're doing on the numbers that they say are the real numbers? That the numbers that the hospitals are reporting, who's checking those guys?
Well, we really can't report, we can't report a death if it didn't happen. I mean, I'm just telling you the facts. Right. That gets all reported. It's double checked by the coroner. It's double checked by the state. So this is where we have to make sure that we aren't spreading misinformation among our own community. All the numbers that we're seeing, these are the rates in the country. Those are, fact checked by the CDC, by the state organizations. There's multiple levels of checking. And so it's easy to think, golly, are they padding the numbers because this seems so absurd? But unfortunately, this is the reality. And I can tell you, I'm watching my colleagues on the front line, and I'm looking at who's coming into the ICU and dying, and what we are seeing equates with those numbers that we're seeing. So I think we really have to spend our time thinking about how do we protect our community and move forward, and not sort of spend time wondering if they're padding. Because I can just tell you, those death rates are real. Because, you know, it's our doctors and nurses and respiratory therapists that are holding people's hands when they're dying in the ICU and their family can't be there. They will tell you it is very real.
Absolutely. And those people who, thank you for being transparent in the thread, who shared that you have gone through the COVID experience. And I do think those numbers should be highlighted as well, of those who actually survive, you know, like, because if not, all you keep hearing is the death message instead of the life message. So we want to breathe life, but we also want to understand reality as well. So this is Kevin Impeccable Peck, representing for the Gen X, with my Gen X people out there. Misha Green, okay, Dr. Golden, we out there. I called you Dr. Green. I forgot. Dr. Green, that's your future, so I'll speak it. I can't represent for the millennials.
Do this for millennials.
Absolutely. And Dr. Draper, of course, representing for the boom millennial.
You know, we still doing Black Power now.
We know, and for those, here's the secret: she is my mother, so she's the only one that gets to call me Kevin. Her and my wife. Everybody else, it's impeccable, y'all. And so, until next time on the Chicken Box, I think interracial versus Black people might be something good. We can't stay heavy for the whole season, guys. This is a season that's different. You can't get to travel and see your family. So we're gonna make these next few Chicken Boxes joyful and fun as we go through our day, and give you just a little lunchtime break or breakfast if you're on the West Coast, or dinner if you're in another country. We thank you for tuning in, and don't forget to visit afro.com and get your holiday subscription, even if it's just for yourself.
And before you hang up, Kevin, someone asked about how to get the shirts, and you and I have the Afro shirt. It is theafromall.com. But if you cannot, someone said they could not access to do online. If you can't do that, Kevin, would you put the number where they can call the regular 410-554? We still have an old-fashioned phone.
Oh, I didn't know. Okay.
410-554-8200. 410-554-8200. And tell Wanda that I told you to call, right? And we'll get the information to the right person. Okay.
All right, there it is. I put the number up. These shirts have saved me. I don't know how many other you guys are just top people and not bottom people, but you know, from the top up, you've been looking good over this pandemic. Just don't stand up during the stream or the Zoom. Everybody have a fantastic day. Thank you, Dr. Golden.
Thank you for having me.